I wasn't quite sure who the audience was going to be, and I haven't had a lot of time, so it's a somewhat muddled set of issues, really. But I want to talk about my passion, really, which is that I think people who are interested in this idea of community empowerment need to recenter power in their thinking about it. Yeah? And I think that's got lost. Even in the best of those examples, I think the notion of power being the core of that has got lost, really. So that's what this is about, and it's based on some work that I'm currently doing, evaluating a very large-scale community empowerment initiative funded through the lottery, where communities, called Big Local, some of you will know it, the communities are given £1 million each over 10 years. It's not a lot of money, actually, and it's not the money that matters, as has been said many times here. It's actually the fact that they've been given control over some money and what that does in terms of their sense of power. So we're evaluating that, and we have, amazingly, and very privileged, to have 8 years of funding to do that research. So it's one of the longest evaluations of a community initiative in the world, actually, I think. And there's a whole range of other initiatives behind that I've been involved in. So I'm just going to say what I mean by community empowerment, and the research on why there is research that says it can reduce social and health inequalities. In principle, there is research that says that. And then I want to just talk about the limits of, I would say, most community approaches. Now, I'm not talking about the Thanet heroes, but I think that it's the people around groups like Thanet, it's the professionals around that are part of the problem in terms of what the way in which this work is being conceptualized. So then I just got some thoughts about what professionals can do to support this. So by communities, I'm talking about people who share a common interest, right? Now, they can be spatially connected, so they might be in a place. They might be in Thanet. They might be in Salford, which is where I'm from in the northwest. They don't have to be. They can be people with sharing a common interest for other reasons. They can be local. We tend to think about communities as local, but they can be national. So the Tenants' Rights Association is a national community, and they can be international. So People's Health Movement is an international community of people interested in health rights. So I think we need to just remember that about communities. They're not only in places, and they're not only local. So for me, empowerment is actually much more than engagement, involvement, and participation. And that's generally what the NHS thinks about, and generally what local authorities think about. It's certainly what Public Health England and Public Health Wales, and I can't remember what the new Scottish organisation's called, but it's probably Public Health Scotland. Yeah, I thought it was. Right. So for me, this empowerment process, and I think for many people over the last decades who've been involved in it, it's enabling people with relatively little power to release the power they have, because a lot of people have the power. And again, one of the problems, I think, with the professional approach is that the assumption that we need to build capacity rather than release capacity. But there is some building to do, gaining capacity. But at the core of this is picking up the point that was made earlier this afternoon. It's a collective control. And a community empowerment is about collective control over decisions and actions that impact on people, right? Unlike the general way in which this stuff is approached, for Public Health England, for Public Health Wales, for Public Health Scotland, I forgot it was being, I'm going to get myself in trouble again. It's basically DIY welfare. That's what community approaches are at the moment. DIY health and welfare. This is not what I think it should be about. So the focus from Alma Ata and before that, the focus on social transformation and political change. That's what the foundational statements about community empowerment say. And I think we've lost that, right? So there's a lot of evidence that it can enhance health and welfare. International evidence. A lot of it is on the proximal. So it can lead to improvements in housing, it can lead to improvement in living standards. It can bring people together. It can address social isolation. It can improve social cohesion. But importantly, it can also increase political understanding. It can make give people power, understanding a bit more about the root causes of the situations they're in. And most of the community initiatives that I have visited around the UK don't do that, right? The professionals around it do not spend time talking to people about the upstream social determinants of the situations they're in. And so the potential for that fourth bullet, for actual increased political understanding, renewed democratic action, civil society activity around social justice changes, we're neglecting it, we're failing it. So what's wrong with contemporary community approach? I've already said a lot of this actually, but whenever there's a recession, empowerment comes right to the fore, and community comes right to the fore. So it's the magic bullet. Community empowerment's the magic bullet, right? It's all everywhere now. It's in the Sustainable Development Goals. In the World Bank is into it, just like they were into social exclusion. Now they're into community empowerment. WHO is into it. This government is into it, and many local authorities are into it. So it is mainstream. It's absolutely in your face out there. But most of these initiatives, I would say, where there are professionals involved, are what I call, they take an inward gaze. It's that interesting notion, I think it was Linda that talked about the strength lexicon, the strength narrative. So what these initiatives are focusing on is the internal dynamics of these communities. And to the extent that they're looking at social determinants of social inequalities, they're looking at the proximal problems, the problems in the neighbourhood. Yeah? Have they got enough parks? Can they ride their bikes safely, if you're lucky, if they've got bikes, right? Behaviour, smoking, obesity, fast food joints. It's all very inward focused. It's all gazing into the community and into these small places. And the trouble is that this risks widening inequalities, because this is happening, it's not just poor communities now, this is a new governance model across all communities. So in Manchester, for example, in the Cheshire Ring, as we call it, where you've got Manchester United and Manchester City, the rich people all living down there, they're all into community participation as well. So they're getting lots of control over decision making. So it's widening inequalities, because the north of Manchester, if you get these same kind of governance initiatives, people don't have the time or capacity to get engaged in this stuff, So that's one risk. But the other risk, as I said, is the outward gaze, the rationale for community empowerment initiatives about social transformation and political change is being lost. It's not there. It's all this inward gaze. So the pursuit of greater social justice is not on the agenda. Indeed, it's probably not allowed to be on the agenda, right? So that's what I think. There's a really urgent need to return to this outward gaze. For people who are designing, delivering, evaluating community approaches with amazing people like the FANET activists, we need to be thinking about where does power fit in this? And I've got this very crude, come to it, this, right? It's very crude. I did this last night. It doesn't look great. But what we're trying to do on the basis of the data we've collected is there are a number of these resources around. The one on your right is the Institute of Development Studies Power Cube, it's called, where people are encouraged to use this when they're designing activities or a community initiative, to think about where power is in this space. This one here is the one that we're developing on the basis of our Communities in Control study, and we've got, come over here, we've got, this is from feminist literature, right? These are the kinds of elements of power which I think are brilliantly illustrated in what you were saying about the working planet, right? That within communities where you're either supporting or working with, or spontaneously they're doing it, what's developing is power within, right? The confidence, the knowledge, the know-how to actually resist the power that is being imposed on them. You're getting developing power to act, right? And you're getting developing power to act with others, right? So when you're thinking as a professional about your community approach, what are you going to do about supporting people to develop power within? Power to and power with. And thinking about it as power, thinking about it in that way, I think will help resist this inward gaze, really. But much more importantly is to do an analysis of the power dynamics within the space. What power is operating over these people? So we've got compulsory power, right? So a classic compulsory power is, for example, the imprisonment of that young man who was objecting to fracking. He was sitting on a truck, went to court, they put him in prison for publicly objecting to that. That's the misuse of compulsory power, and it's happening all over this country against communities that are resisting. Institutional power, Grenfell, right? The tenants of Grenfell for years were trying to get people to act. The institutions hid that knowledge. That's the misuse of institutional power. Structural power, that's class, that's race, that's gender issues, right? This is maybe the most familiar, although we don't think about what we do about addressing that. And then there's productive power. I think this is the most invidious, because what's happening here is that, and we're all part of it, communities, poor communities, are being encouraged to think it's their responsibility to act, right? The public sector's being undermined. So what do? We get the GPs to do the social prescribing, we get the communities to do stuff on their own, or we'll support them to do it. That's the misuse of productive power, right? We're helping construct an identity for communities which is undermining the public sector. It's undermining the provision of public services, including the NHS. So this power is really important as well, and that stigmatization that's going on, that lexicon about strength, that's part of the productive power and misuse of productive power. So I think when we're designing or helping to design or working with communities, we need to have a power frame. It doesn't have to be this one. It could be the Institute of Development Studies one. You can do it yourself. But put power in the middle of it and think about what power is being used against these communities, and how can we build, support, release the power of communities to resist this. And the communities must be local, national, and international. So Thanet need to be connected to, we need to fund their ability to connect with other groups doing the same thing in some way, because that's where real power with will come from. That's enough for me.